Did you know that the same vitamins you take to protect your brain could actually be raising your risk of a stroke overnight? It sounds unbelievable, doesn't it? You eat well, you walk every day, you take your supplements just like your doctor or favorite TV ad suggested, and yet, inside your body, something dangerous could be brewing while you sleep. One small pill, taken with the best intentions, may quietly harden your arteries, thicken your blood, or thin it too much until one morning you wake up and can't lift your arm, can't speak, can't move. As a brain doctor who has spent decades treating older adults across America, I've seen it happen too many times. The tragedy isn't from bad habits, it's from good intentions gone wrong. Vitamins that promise strength, sharper memory, or heart health can, in the wrong dose or combination, trigger the very thing you're trying to avoid: strokes, brain bleeds, and blood clots. If you're over 60, this message might just save your life, because what you don't know about your vitamins could change everything, starting tonight. Before we dive in, if you haven't subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. 1. Vitamin D, the silent calcium trap. If you're over 60, this may be one of the most important things you'll ever hear about your health. Vitamin D, the sunshine vitamin that everyone praises, may quietly be putting your brain in danger while you sleep. You've probably heard it's good for your bones, your mood, even your immune system. That part is true. But what no one tells you, not even most doctors, is that when taken in the wrong dose or at the wrong time, vitamin D can turn from a friend into a silent threat. Here's what happens. When you swallow a high dose of vitamin D, say 5,000 or 10,000 IU per day, as many over-the-counter supplements contain, it tells your body to absorb more calcium from your food and release more calcium from your bones into your bloodstream. At first, that sounds helpful. You think you're strengthening your skeleton. But inside your arteries, that excess calcium starts to harden and stick. It lines the walls of your blood vessels like cement, making them stiff and narrow. Now imagine that happening inside your brain's delicate network of blood vessels. Those tiny arteries, once flexible and smooth, become brittle. And when blood tries to push through those narrow passages under the pressure of age, dehydration, or a restless night, the risk skyrockets. It triggers strokes. It forms blood clots. One moment you're sleeping peacefully. The next, a clot travels up, blocks blood flow to your brain, and within seconds, your speech slurs, your hand goes limp, and your world changes forever. I've seen this too many times in my career. Mr. Walter, a 74-year-old veteran from California, took his vitamins faithfully every night. He never missed a dose. A proud man who took care of his health, or so he thought. But one morning, his wife found him sitting on the edge of the bed, confused, unable to speak. His calcium levels were dangerously high. The cause, vitamin D toxicity. His arteries had hardened from years of oversupplementation, and a small clot had stolen his independence overnight. What makes this so dangerous is how invisible it is. There are no warning signs. You don't feel pain. You don't get dizzy. You go to bed feeling fine, believing you're protecting yourself, when in fact you're building the perfect conditions for a stroke in your sleep. And here's the real kicker. Most older adults in the US are not vitamin D deficient. The body only needs around 600 to 800 IU a day, sometimes 1,000 in winter months. But supplement companies sell 5,000 IU, 10,000 IU capsules, convincing you that more is better. The truth is, after 60, your liver and kidneys can't process that much. The calcium stays in your bloodstream, turning into silent, deadly pressure on your arteries and brain. If you're taking vitamin D right now, stop and check your dosage. Ask your doctor for a blood test. Never take it at night. Your body processes it better in the morning when your blood pressure and heart rhythm are more stable. And remember, more is not better. Balance is what protects you. Because in the quiet hours of the night, when your heart slows and your vessels tighten, a little too much of this good vitamin can steal everything you've worked for: your independence, your memory, even your voice. And if you thought that was shocking, wait until you hear about the vitamin that's supposed to protect your heart, but can make your brain bleed instead. If you're still watching and finding these insights helpful, please comment number 1 below to let me know you're with me. Now let's move on to point number 2. 2. Vitamin E, the bleeding risk. Vitamin E. It sounds so innocent, doesn't it? The heart helper, the vitamin that promises smoother circulation, better memory, younger skin. For decades, millions of older Americans have been told that taking a little extra vitamin E each day can protect their heart and brain. But as a brain doctor, I can tell you something few ever hear. This same vitamin, when taken in the wrong way or combined with the wrong medication, can trigger a stroke, not from a clot, but from bleeding inside the brain. You see, vitamin E is what we call a natural anticoagulant. It thins your blood. In small amounts, that can be helpful. It keeps your platelets from sticking together, which reduces clot formation. But here's the problem. As we age, our blood vessels become fragile, our brains more delicate, and most of us are already taking medications that thin our blood. Aspirin, warfarin, Plavix, or others prescribed after a heart procedure. Add high-dose vitamin E to that mix, and your blood can become so thin that even a small bump or a tiny rupture inside your brain can turn deadly. Let me tell you about Mrs. Evelyn Brooks, an 81-year-old retired librarian from Ohio. She was sharp, witty, and proud of taking care of herself. She read that vitamin E supports circulation and memory, so she added an over-the-counter capsule, 800 IU daily, to her morning routine. What she didn't realize was that she was already taking warfarin for her heart valve. 3 weeks later, she was rushed to the emergency room after collapsing with a severe headache and vomiting. Her brain scan revealed a hemorrhagic stroke, bleeding inside her brain. There was no fall, no trauma, no warning. The culprit? Her blood had become too thin to clot. The combination of vitamin E and her medication had silently created the perfect storm. When the brain bleeds, it's like a flood in a fragile city. One vessel breaks, pressure builds, and neurons drown in seconds. You can't think, you can't speak, you can't move. Sometimes you don't wake up. It's one of the most devastating events I see in my practice. And it often starts with someone who truly believed they were doing the right thing for their health. Even for seniors not on medication, large doses of vitamin E, 400, 800, even 1000 IU per capsule, can cause problems. Studies have shown that these high doses can increase the risk of hemorrhagic stroke by nearly 20%. That means 1 in 5 people could face a higher risk just by taking what they thought was a safe vitamin. The recommended daily amount for adults is only 15 milligrams, or about 22 international units, a tiny fraction of what's in most supplement bottles. You can easily get that from foods like almonds, sunflower seeds, spinach, or olive oil without the risks. Here's what many people don't realize. Bleeding strokes can happen just as suddenly as clots. The symptoms, a blinding headache, confusion, slurred speech, or collapse, are terrifying. And while blood clot strokes block oxygen to the brain, bleeding strokes drown it. It triggers strokes, it forms blood clots, It steals your speech and your memory depending on which way your blood swings. Too thick or too thin, both can be deadly. Mrs. Brooks survived, but she walks with a cane now. Her short term memory isn't the same. And every time I see her, she tells me, "Doctor, I just wanted to help my heart. I didn't know I was hurting my brain." Those words stay with me because they echo what I've heard from so many others: good intentions, dangerous results. So if you're over 60 and taking vitamin E, check the label. If the number says 400 IU or higher, especially if you're on blood pressure or heart medications, talk to your doctor before another capsule touches your lips. One small change could mean the difference between independence and a lifetime of rehabilitation. And if you thought thinning your blood was risky, wait until you hear about the next vitamin, the one sold as a nerve booster that can quietly destroy the very nerves it promises to protect. 3. Vitamin B6, the nerve destroyer. There's a dangerous myth spreading among older Americans, and that if your hands tingle, if your feet feel numb, or if your memory slips, all you need is more vitamin B6. You see it everywhere, on bottles that promise nerve support, brain boost, and energy for seniors. It sounds safe. After all, it's just a vitamin, right? But here's the truth I wish every older adult in America knew. Too much vitamin B6 can quietly destroy the very nerves it claims to protect, and once that damage is done, it may never heal. Your nervous system is like an electrical network. Every thought, movement, and heartbeat depends on tiny nerve fibers carrying messages throughout your body. Each of those fibers is wrapped in a protective coating called myelin, a thin, delicate sheath that insulates your nerves just like plastic around a wire. Vitamin B6 helps your body maintain that insulation in small amounts. But when you flood your system with too much, that protection starts to break down. The insulation peels away. The wires inside your nerves start to short circuit. The result? Tingling, burning, numbness, muscle weakness, and balance problems that can look just like aging. But it's not aging, it's damage. I'll never forget Mr. Harold Jenkins, a 76-year-old retired truck driver from Kansas. He came into my clinic with a simple complaint: "Doc, my feet just feel funny." At first, it was a mild tingling. Then he started stumbling, dropping things, and struggling to button his shirt. He assumed it was arthritis or poor circulation. But when I reviewed his supplements, I was stunned. He'd been taking 2 tablets of a nerve and brain support formula every morning, each one packed with 100 milligrams of vitamin B6. That's 200 milligrams a day, 20 times higher than the recommended safe limit for seniors. And he'd been doing it for over a year. His blood tests showed toxic levels. The nerves in his legs were literally dying. Unlike some vitamins, B6 doesn't wash out easily. It builds up in your tissues day after day, silently corroding your nerves from the inside. The tingling you feel isn't energy, it's nerve damage, and for some, it becomes permanent. Harold was lucky. We stopped the supplement just in time. The damage slowed, but it didn't reverse. He still uses a cane today. He told me, "I was just trying to protect my brain, Doc. I didn't know I was poisoning it." High doses of vitamin B6 don't just damage your nerves. They can also disrupt your blood vessels, making your body more prone to inflammation, clotting, and unpredictable blood pressure spikes. It may sound unbelievable, but I've seen it. When nerves misfire and blood vessels constrict unevenly, the brain becomes vulnerable. It triggers strokes. It forms blood clots. The very supplement that promises sharper thinking can end up silencing the mind forever. The real tragedy is how easy it is to fall into this trap. Most seniors think if 1 tablet helps, 2 must help more. They trust the labels: natural, clinically proven, doctor formulated. But the truth is, the Food and Drug Administration doesn't strictly regulate supplements. That means a bottle sitting on your pharmacy shelf could hold a dose high enough to hurt your brain. So here's what you should remember. Your body only needs 2 to 10 milligrams of vitamin B6 a day, and you already get most of that from food: chicken, fish, bananas, potatoes. You don't need more, you just need enough. Check your labels. Add up your total daily dose. If you see more than 10 or 20 milligrams, you're taking a risk your nerves may not forgive. And if you think your eyes are safe from harm because you're only taking vitamins for your vision, I need to warn you. The next one on our list may be the most deceptive of all. It's the vitamin that promises to protect your sight, but can quietly raise the pressure in your brain until it mimics a stroke. If you're still watching and finding these insights valuable, please comment number 1 below to let me know you're here. Now let's keep going with point number 4. 4. Vitamin A, the vision illusion. If you're over 60, you've probably been told at least once that vitamin A keeps your eyes sharp and your immune system strong. Maybe you even take it faithfully every day, believing it's helping you see clearer, age slower, and stay healthier. But what most people don't realize is that this so-called vision vitamin, when taken in excess, can quietly become one of the most dangerous substances for your brain. I've seen it more times than I care to remember. Older adults who thought they were doing something good for their eyesight, only to end up in the hospital with symptoms that looked exactly like a stroke. Vitamin A is fat-soluble, which means your body doesn't flush it out like vitamin C or B. Instead, it stores it in your liver, your tissues, and yes, even in your brain. Over time, those levels build higher and higher, especially in older adults whose livers no longer process vitamins as efficiently as they once did. Eventually, that buildup becomes toxic. It raises the pressure inside your skull, presses against delicate veins and arteries, and disrupts the normal flow of spinal fluid that cushions your brain. When that happens, you might start to feel dizzy. Your vision may blur or double. Your speech might slur, and your head could pound with unbearable pressure. To an untrained eye, it looks just like a stroke. But in truth, it's vitamin A toxicity, a silent overload that's literally squeezing your brain from within. Let me tell you about Ms. Dorothy Simmons, a 79-year-old retired piano teacher from Oregon. She was independent, full of life, and proud of her healthy habits. For nearly 5 years, she took a high-dose vitamin A supplement, 10,000 IU daily, because she read that it was good for vision and skin. Then one morning, she woke up dizzy. Her eyes couldn't focus. When she tried to walk, her balance gave way, and she collapsed. Her family thought it was a stroke, but the scans showed something strange. No bleeding, no clot. Instead, her brain was swollen, her spinal fluid pressure dangerously high. The cause was clear. Years of vitamin A accumulation had poisoned her system. In older adults, this condition is known as pseudotumor cerebri, literally false brain tumor. It mimics everything about a stroke: the confusion, the slurred speech, the blurred vision, and it can be just as devastating. Left untreated, it can lead to permanent vision loss or cognitive decline. What's worse, the early signs, headaches, fatigue, slight dizziness, are easy to dismiss as part of aging. But inside, the pressure keeps rising, the veins grow tighter, and the brain struggles for oxygen. Eventually, that stress can trigger strokes. It forms blood clots. The same vitamin meant to protect your sight can end up stealing your vision, your balance, even your independence. The tricky part is that most people don't realize they're overdosing. Many multivitamins already contain the full recommended dose of vitamin A, about 2,500 to 3,000 IU per day, but add an extra eye health or anti-aging formula on top, and you could easily double or triple that amount. Unlike water-soluble vitamins, your body doesn't get rid of the excess. It stores it every day, every dose, silently building toward danger. If you're over 60 and taking vitamin A, check your labels tonight. Add up the total amount from all your supplements. If it's over 3,000 IU a day, talk to your doctor. There's no need to gamble with your vision or your mind for something you could easily get from real food. Carrots, spinach, sweet potatoes, or eggs. Nature provides exactly what your body can use in the right balance without overloading your brain. And if you think vitamin A's effects on the brain are frightening, wait until you hear about the vitamin that's supposed to support your heart, but can send your blood pressure soaring and leave you seconds away from a stroke. 5. Niacin vitamin B3, the blood pressure roller coaster. Niacin, you've probably seen it on bottles labeled heart health, cholesterol support, or energy boost. It's one of the most popular vitamins among older adults in America because it's often marketed as a natural alternative to prescription drugs. And yes, niacin, also known as vitamin B3, can help lower cholesterol when used correctly. But what most people over 60 are never told is that this same vitamin, when taken in high doses or without medical supervision, can quietly send your blood pressure on a dangerous roller coaster, one that can end with a stroke. Here's how it happens. Niacin works by dilating your blood vessels, expanding them to improve circulation. You might have felt it yourself, that sudden warmth or redness in your face and neck after taking a supplement. That flush isn't just a harmless side effect, it's your blood vessels opening rapidly. But what goes up must come down. After that quick expansion, your vessels suddenly constrict, tighten, even harder than before. And when that happens inside your brain or heart, it can trigger strokes. It forms blood clots. As a neurologist, I've seen this pattern too often. An older patient comes in complaining of dizziness in the mornings, pounding in the chest, and a sudden sense of pressure behind the eyes. They think it's stress or dehydration, but when we look closer, we find the same cause: niacin toxicity. One patient I'll never forget was Mr. Frank Miller, an 82-year-old retired postman from Florida. He'd started taking an over-the-counter cholesterol support supplement that promised stronger circulation and healthier arteries. What he didn't realize was that each serving contained 1,000 milligrams of niacin, 20 times what his body needed. He took it twice a day, thinking more was better. Within a few weeks, his blood pressure began swinging wildly, normal 1 hour, dangerously high the next. One morning, while getting dressed, he suddenly couldn't speak clearly. His right arm went weak. It lasted only a few minutes, then disappeared. That was a transient ischemic attack, a mini stroke, a warning sign that the next one could be fatal. His brain scan showed narrowed arteries and microclots forming along the vessel walls. The culprit was clear. The same vitamin meant to protect his heart was quietly harming his brain. Niacin doesn't just affect blood vessels. High doses can also inflame the liver, upset blood sugar control, and disrupt heart rhythms, all of which make the brain more vulnerable to oxygen loss and clots. Older adults are especially at risk because their circulation and organ function slow down with age. What your body could handle at 30, it can't at 70. A dose that once seemed harmless can suddenly push your blood pressure high enough to burst a vessel or low enough to starve your brain. The danger lies in the numbers. Most seniors only need around 14 to 16 milligrams of niacin a day, easily obtained from whole foods like chicken, salmon, tuna, or peanuts. But supplements often contain 500, 1,000, or even 2,000 milligrams per pill. The label may say flush free, but that doesn't make it safe. It just hides the warning signs. Even without the redness, your blood vessels are still reacting underneath. Mr. Miller recovered after stopping the supplement and switching to a diet rich in natural niacin sources. He told me, "I thought I was helping my heart, doc. I didn't know I was gambling with my brain." Sadly, his story isn't unique. Across the country, many older adults take niacin daily without realizing how close they are to a medical disaster. So, if you're taking a heart health supplement, check the fine print tonight. Look for the words niacin, nicotinic acid, or inositol hexaniacinate. If the dose is above 50 milligrams, talk to your doctor immediately. It's not worth risking a stroke for a bottle that promised energy. Because the truth is, niacin isn't the only energy booster that can hurt you. The next vitamin we'll talk about is one most people think is completely harmless. But in high doses, it can quietly damage your kidneys, raise your blood pressure, and set off the same deadly chain reaction inside your brain. 6. Vitamin C, the hidden kidney risk. For generations, Americans have been told that vitamin C is the safest vitamin you can take. We've been taught that if you feel tired, achy, or under the weather, a little extra vitamin C will boost your immune system. You see commercials showing smiling seniors drinking orange juice or popping those big, fizzy tablets that promise strength and protection. But here's the truth that no one talks about. For older adults, taking too much vitamin C can quietly set off a chain reaction inside the body that damages the kidneys, raises blood pressure, and even leads to strokes. Vitamin C, in small amounts, is essential. It helps repair tissues, supports immunity, and fights inflammation. But once you cross the threshold, usually around 1,000 milligrams a day, your body begins to convert the excess into a compound called oxalate. These oxalates crystallize in your kidneys, forming sharp stones that block blood flow and trap toxins in your bloodstream. Over time, those stones inflame the kidneys, stiffen the arteries, and raise your blood pressure. It's a silent process. No pain at first, no dizziness, just gradual strain on two organs you depend on to keep your blood clean and your brain alive. Let me tell you about Mrs. Laura Knight, a 70-year-old grandmother from North Carolina. She was healthy, active, and proud of staying pill-free, except for one thing, her daily vitamin C habit. Every morning, she mixed 2 1,000 milligram packets into her water because she believed it would keep her strong. For months, she felt fine. Then one day, she noticed a dull ache in her lower back. She ignored it, thinking it was arthritis. Weeks later, the pain became unbearable. When she arrived at the emergency room, her blood pressure was dangerously high, and her kidney function had dropped to half of what it should be. Scans showed multiple oxalate stones blocking her left kidney. Her doctor told her that her supplement routine, something she thought was helping her, had been slowly poisoning her body. The kidneys are your body's natural filters, and when they're damaged, the effects ripple everywhere, especially to the brain. Damaged kidneys can't control blood pressure properly. They allow toxins and calcium to build up, making your arteries harder and narrower. When that happens, it doesn't take much for a clot to form, travel upward, and block blood flow in the brain. It triggers strokes. It forms blood clots. You may think you're just feeling fatigued, but inside, your blood pressure is rising, your vessels are tightening, and your brain is one heartbeat away from losing oxygen. The danger is that vitamin C toxicity creeps in silently. Most older adults don't realize that they're overdosing because they're getting vitamin C not only from supplements but also from fortified juices, multivitamins, and powders. The body only needs about 75 to 90 milligrams per day. That's the amount found in a single orange or a handful of strawberries. But many seniors are consuming 10 to 20 times that amount without realizing it. The more you take, the more oxalate forms, and the more your kidneys struggle to keep up. If you're over 60, the best thing you can do is scale back. Skip the megadose powders and effervescent drinks. Eat real fruits and vegetables instead. Hydrate well and give your kidneys a chance to flush naturally. Supplements should never replace common sense or your body's own limits. Because while vitamin C may seem harmless, your body's balance is fragile. Too much of anything, even something good, can tip it toward danger. And if you thought kidney damage was the end of it, wait until you hear about the final vitamin on this list, one that millions of older Americans take every day for memory and heart health, but that can quietly mask a deadly deficiency in your brain. 7. Folic acid, vitamin B9, the masked danger. Folic acid, the brain vitamin. You've probably heard it's good for memory, heart health, and even helps prevent anemia. Many older Americans, wanting to protect their brains and stay sharp, take it daily without a second thought. It's in multivitamins, breakfast cereals, energy drinks, and senior brain support formulas. On the surface, it seems harmless, even smart. But beneath that promise of protection lies one of the most overlooked risks for aging adults. Too much folic acid can quietly mask a deadly deficiency in your brain, one that leads to nerve damage, cognitive decline, and stroke. Here's how it happens. Folic acid and vitamin B12 work together like partners in your body. B12 keeps your nerves healthy and helps your brain produce the red blood cells that carry oxygen. Folic acid helps make DNA and supports cell repair. But when you take too much folic acid, especially in supplement form, it can hide the early signs of vitamin B12 deficiency. You might think you're doing fine because your energy feels stable and your blood work looks normal. But inside your brain, something dangerous is happening. Without enough B12, your nerve cells begin to deteriorate. The protective coating around them, the myelin sheath, starts to thin and fray, like insulation wearing off a wire. Over time, those frayed nerves misfire, causing confusion, tingling, memory loss, and eventually dementia-like symptoms. For older adults, this danger is even greater. After 60, your stomach produces less acid, which means you absorb far less vitamin B12 from food. So even if you're eating well, your levels naturally drop. When you then add large doses of folic acid, often 800 to 1,200 micrograms a day from supplements, your body becomes fooled. The folic acid corrects your anemia, so doctors may miss the signs of B12 deficiency entirely. Meanwhile, your brain and nerves are silently deteriorating. I've seen it too many times. Patients in their 70s and 80s who come to my office thinking they're developing Alzheimer's. But the real culprit is a long-term imbalance between folic acid and B12. Let me tell you about Mr. Raymond Hill, a 79-year-old retired teacher from Michigan. He took a senior memory support vitamin pack for nearly 3 years. He said it helped him stay sharp. But slowly he began forgetting names, losing balance, and stumbling over words. His blood tests showed high folate levels, almost double normal, but his B12 was critically low. His brain scans revealed signs of nerve degeneration. We stopped the folic acid and began B12 therapy, but some of the damage couldn't be undone. I just wanted to help my brain, he told me quietly, not lose it. What most people don't realize is that B12 deficiency and excessive folic acid together also affect your blood vessels. When the balance between the two is disrupted, homocysteine, a toxic amino acid, builds up in your blood. High homocysteine thickens vessel walls, makes your arteries less flexible, and it triggers strokes. It forms blood clots. It doesn't matter how many vitamins you take. If your blood becomes sticky and your brain's oxygen supply is cut off, one small clot can change your life forever. For seniors, the solution isn't to fear vitamins, it's to respect them. The safe upper limit for folic acid is around 400 micrograms a day. More than that, especially without checking B12 levels, is gambling with your memory, your mobility, and your mind. Get your B12 tested once a year. If you take folic acid, make sure you're also getting enough B12, ideally from food sources like fish, eggs, or fortified cereals. Because here's the truth, no supplement company will ever tell you your brain doesn't need more pills, it needs balance. And that balance is what we'll uncover in the final part. The truth about how real food, not megadoses, can protect your brain and extend your life far better than any bottle ever could. The final wake-up call. Your brain doesn't need more pills, it needs balance. If you've stayed with me through all 7 of these vitamins, take a moment to breathe and let this truth sink in. At this stage of life, every choice you make matters more than ever. The pills that promise health, youth, and energy might seem harmless, but for older adults, they can quietly do the opposite. They can confuse your heart, harden your arteries, weaken your nerves, and yes, even steal your memories. Your brain is not a machine that runs on megadoses. It's a living, breathing organ that thrives on balance, on oxygen, clean blood flow, hydration, and real nutrients from real food. After 60, your metabolism slows, your liver filters less efficiently, and your blood vessels lose flexibility. That means supplements that once helped in your younger years can now overwhelm your body. Too much vitamin D hardens your arteries. Too much vitamin E makes your blood too thin. Too much B6 burns your nerves. Too much A or C strains your brain and kidneys. Too much niacin sends your blood pressure spinning. And too much folic acid hides the very deficiency that keeps your mind alive. Each one, when abused, can lead to the same silent outcome. It triggers strokes, it forms blood clots, it damages the brain you've spent a lifetime building. But here's the hopeful part. You still have control. You don't need to live in fear. You just need awareness. The body at 70 or 80 doesn't need more. It needs right. It needs care, moderation, and wisdom. The safest, most powerful medicine you can give yourself is found in your kitchen, not your cabinet. A breakfast of eggs, avocado, and whole grains gives your brain clean fuel. Leafy greens protect your vessels. Fish and nuts feed your neurons. Water flushes toxins. Sleep resets your circulation. These are the habits that truly preserve the mind. If you remember one thing, let it be this. Vitamins were never meant to replace your body, only to support it. Listen to what your body whispers before it has to scream. Read your labels, ask your doctor, and don't be afraid to stop taking something that might be doing more harm than good. Because in the end, the goal isn't just to live longer. It's to stay clear, steady, and independent for as long as possible. You've spent a lifetime earning your wisdom. Don't let a pill steal it. Choose balance, and your brain will thank you every day you wake up. Still yourself, still strong, still here. These lessons are meant to inspire you to live fully and authentically. Now, I'd love to hear from you. Take a moment to reflect and share one thing you've learned and plan to apply in your own life. Let's support each other on this journey toward embracing these truths. If you enjoyed this video, please leave a comment with 1. If not, feel free to comment with 0. Your feedback means a lot to us. Don't forget to like, share, and subscribe to our YouTube channel for more content like this. Thank you for watching, And here's to living life on your own terms.